Good afternoon, all. Myself, Mrs. Farveen, lecturer, Department of Childhood Nursing from Sri Lakshminarayana College of Nursing. So now I am going to take a topic on immediate care of the newborn. So newborn period is very crucial, and we have to give the proper care to the newborn baby. So because of immaturity, so many illnesses may happen because of immaturity. So we have to care uh, the newborn immediately after the birth. So let me see the introduction first. So the first 24 hours of life is a very significant time due to critical transition from the intrauterine to the extrauterine life. So the first 24-hour period is a very important period for the baby. So who born from the mother's uterus to the extrauterine life. So we have to be conscious to care of the baby. So we have to observe the baby clearly. So what are the problems may arise. So we have to underline any problem the baby is having. So we should monitor the baby. So what are the purposes of immediate care of the newborn? So what is the importance or what is the purposes of the immediate care of the newborn? So immediately after the birth, what are the care we should give? Also, why we are giving the care to the baby? So what is the purposes of the baby? Let me see. So first point is establish and maintain respiratory function. So we have to give the and monitor the respiratory status and respiratory functions of the baby because of the immaturity, and from the intrauterine to the extrauterine life, we have to carefully monitor the baby's respiratory function. So it has to be done in the NICU. And second point is provide warmth and prevent hypothermia. So we have to be careful to have a normal temperature of the baby. So we have to prevent the hypothermia. So we should provide the warmthness to the baby. So third point is ensure safety from injury and also the infections. So we should be careful regarding the safety of the baby. So we should prevent the injury and also infections in the hospital setup. So next point is identity actual and potential problems that might require the immediate action. So if we have seen any problems, any actual or the potential problems, so we have to be careful in identifying the problems may arise. We have to give the proper treatment according to the symptoms. So these are all the purposes of the immediate care of the newborn. So next is what are the immediate care of the newborn? So next point, immediate care of the newborn. What are the things we should be careful is first one is the airway. So airway is very important. So because of immaturity of the lungs, so we have to be careful on the baby. So especially the airway is very important. And second thing is the breathing. So whether the baby's breathing is normal or any abnormal sounds is hearing. So we should monitor that. And third thing is the temperature. So we should monitor the normal temperature of the baby. If the baby goes any low temperature and loss of any temperature, we should be careful and monitor the temperature regularly. And the fourth thing is the Apgar. So Apgar we should monitor at the 1 minute after the birth, and after that we should monitor at the 5 minutes. So the minimum score is 3 and maximum score is 10. We should be monitor the Apgar scoring. And fifth one is the identification. We should see any marks or any scars after the delivery. The baby is having any abnormalities, we should identify immediately and give the care promptly according to the symptoms. So these are all the 5 things the immediate care is noting for that. So next is the implementation. So what are the care we should give and what is the intervention we should give to the baby immediately after the birth? So first, immediately after the birth of the baby, so first thing we should do is oropharyngeal suctioning. So first thing we should do is wipe the neonate's mouth with a piece or gauze around your index finger once his head has been delivered. So baby may have the oral secretions in their mouth. So we have to be careful for that and to remove the secretions through the bulb sucker or with the use of the gauze, we can remove the secretions from the baby's mouth. And third thing is wrap and dry the neonate in a warmed towel. So immediately after the birth, baby may have the vernix caseosa. We should dry it. We should not forcefully remove that vernix caseosa. We can just wrap and dry the neonate in a warmed towel. So to prevent we should be careful regarding the temperature of the baby. So we should wrap the baby immediately the birth. to prevent the heat loss. And fourth thing is like next point is the suction the neonate's mouth with a disposable suctioning. So we should remove the secretions from the mouth of the baby. So we should do the suctioning. So we have to take the secretions from the neonates. So it is important. So this is under the oropharyngeal suctioning. So this is the first thing we should do immediately after the birth. So next is place the neonate in a radiant warmer. So why we are putting the baby in the radiant warmer is to prevent the heat loss. The baby will not adapt to the new environment. So immediately after the birth, we have to place the neonate in a radiant warmer under the proper temperature. So next is replace the wet towel and wrap the neonate in another dry towel. So first we have clean the towel like baby with the wet towel, no? So we have to remove the towel and use another dry towel and wrap the baby with the dry towel. So next is place newborn in Trendelenburg position to prevent the aspirations. So next is do the suction of the oropharyngeal canal, do use of the bulb sucker. And next is oxygen may be given in case if it is necessary, we can give the oxygen. And next thing is continue the suction as fluid is aspirated. Okay, so these are all the things we should do under the, immediately after. Yeah, so first image shows that we have to dry the baby first immediately after the birth. And next, use the dry towel, like replace the wet towel and use another towel as a dry towel. We should remove that wetness from the baby. So we should use the another towel that is a dry towel. Okay, so next is the next we should do the positioning, that is a right lying position. So why we are keeping this right side lying position means we are promoting the dryness secretion. So immediately after the birth there will be a secretions in the mouth. So if you are using this position, this can be drainage can be easily and fasten the gastric emptying also, and it promotes a good airway. Okay, so for that only we are keeping this position immediately after the birth. So first thing we should monitor is airway and also breathing. So what we should do in this airway and breathing is suction gently and quickly using bulb syringe or the suction catheter. So immediately after the birth, we should remove the secretions from the mouth. So we should do the gentle suctioning through the use of the sucker, also the and also the catheter. So next is starts in the mouth, then the nose to prevent the aspiration. First, we should do the suctioning by the from the mouth and then go to the nose. So this is the order of clearing the airway in the baby. So this is why. So first we should clear the mouth and then go for the nose. So this is the image that shows the secretions like so next is stimulate the crying. If the baby is not crying immediately after the birth. So crying indicates that the baby is having a good breathing. That is a signs of the good breath. So if the baby is not crying immediately after the birth, so we should stimulate the crying by rubbing at the back of the baby. So next is positioning the a proper position should be maintained. That is a side lying, and also if needed, provided the oxygen if it is necessary. Okay, so this is very important. So we should monitor the airway continuously. Baby is having any abnormalities, immediately we can shift into the NICU under the adequate monitoring. So next is assess the newborn's conditions. So what are the things we should monitor and what are the things we should assess immediately after the birth? So first thing is we should monitor the ABGA score. Okay, so immediately after the birth, that is after within 1 minute, what is the ABGA score and reassess the ABGA score after the 5 minutes. So it is also very important. So immediately after the birth, that is 1 minute, we should record the scoring and re-record the scoring after 5 minutes. Okay, so next thing we should assess is neurological examination by checking common reflexes of the newborn. So there will be a primitive reflexes among the newborn babies. We should monitor all the reflexes. If it is present or elicited, so the baby is neurologically normal. So if we are identifying any problems or anything we are happening in the reflexes, any problems in the reflexes, so the baby is having any neurological disturbances. So we have to monitor the reflexes. After the ABGAR, we should monitor the and identify the reflexes also. So third thing is vital signs, that is pulse, respiration, and also the temperature. So what is a normal? So the nurses has to know what is a normal pulse rate and what is a normal respiration and what is a normal temperature of the newborn baby. So then only we can see the normal, what is the baby's temperature and what is the normal temperature, we can differ. Okay, so next is a growth measurement, including the baby's length, weight, and head and chest circumference. So immediately after the birth, so newborn baby, the length will be the 50 centimeters is a normal, and weight will be 2.5 to 3.5 centimeter, and say head circumference will be 35 centimeter, and chest circumference will be 33 centimeter. So this will be a normal one. If it is more than that, otherwise less than that means the baby is having a growth retardation. So these are all the things we should assess. Next slide is next point is we should assess for any gross abnormalities, congenital defects in the head like hydrocephalus, or babies having any congenital malformations like spina bifida. So we should monitor any abnormalities. We should report into the pediatrician or the neonatologist. So next we should see for the eyes. So eyes we should monitor any ophthalmia neonatum is present. So that is a infection which is present immediately after the birth. And ears we can monitor any infections or any pus drainage from the ears. And also we should monitor the chest retraction, any retraction or grunting, any abnormal sounds. If it is present, we should monitor immediately and do the proper treatment to the baby. And spine, we should monitor any abnormalities like neonatal, like congenital abnormalities, any abnormal spinal curvature or any spina bifida, occulta or cystica, we should monitor. And face, we should monitor the cleft lip, cleft palate or any other abnormalities on the face, we should monitor. And nose, we should monitor for the any abnormal drainage or any like nasal flaring is there. So we should monitor it in on the nose. So next we will see the abdomen. So we are in the abdomen, we should monitor the abdominal rise and any abnormal like umbilical hernia is there. So we should monitor for that. So next is anus for the both the male and female babies. We should monitor for any ambiguous genitalia or any problems in the neonatal abnormalities like congenital abnormalities of genitals, we should monitor. And extremities, if it is problems of congenital anomalies like polydactyl or syndactyl, we should monitor for that. So next, we should assess for any signs of eye infection. So it is most common. So for the babies, like ophthalmia neonatum, that is an infection and inflammation of the conjunctiva. So that seems to be happen. So we have to monitor whether the baby is having any signs of eye infection. So these are all the things we should assess immediately after the birth. So first thing we should monitor is ABGAR score. So the ABGAR score is determined by evaluating the newborn baby on 5 simple criteria on a scale from, that is minimum, like from the 0 to 2, that is summing up of 5 values. That is each line is 2, that is maximum of 10 scores and minimum of 3. So from that scale, so 0 to 10 will be there. So the resulting ABGAR score ranges from the 0 to 10. Okay, so that is the ABGAR scoring. So immediately after birth, that is 1 minute, we should see for the ABGAR score, and after 5 minutes, we should note for the ABGAR. So this is the ABGAR scoring system. So A is the activity or muscle tone of the baby, and P stands for pulse or heart rate, and G stands for grimace or reflex irritability or responsiveness, and A stands for appearance or skin color of the baby, and R stands for respiration and also the breathing. So ABGAR we must know, because every baby immediately after the birth, we should monitor compulsorily. So ABGAR scoring is very, very important. So ABGAR is like the minimum score will be 3 and maximum is like 0 to 10 is a scale. So minimum is 3 to 10. So this is the ABGAR scoring. So first sign is the heart rate. So that is a pulse. So if the baby is having no pulse, okay, so that indicates that we can give the score of 0. So if the baby is having below 100 beats per minute, so we can give the score 1. If the baby is having more than 100 beats per minute, so the normal pulse rate will be 120 to 160. So above 100 means we can give the scoring of 2. So minimum is 0 and maximum is 2. Okay, so next is the respiratory effort. So respiratory effort, the baby is not having a proper breathing. No breathing means we can give score of 0. And if the baby is having a weak cry, okay, so crying is very important. So if the baby cried well, baby is good. If the baby is having a weak cry, we can give the scoring of 1. If the baby had good and strong cry, we can give the score 2. So, and third thing is in ABGA score is muscle tone. Okay, so how the muscles and how it is responding. So if no muscle responsiveness is, we can give this 0. And baby is doing some flexion of extremities means we can give 1. So baby is doing all the flexion and extension and active motion it will be there means we can give the score of 2. And fourth thing is reflex irritability. Okay, so first is no response means we can give 0. The baby is having a minimal reflex irritability means dryness, that is we can give the 1. Baby is giving a adequate crying. Okay, so more strong cry means we can give 2. So next we should note for the color, skin color. If the baby is blue or pale, like a full body is blue or pale, we should give 0. If only body is pink, only the extremities are blue means we can give 1. So next, full body is pink in color means we can give 2. So minimum is like a 0 to 10 scoring. So minimum is 3 to maximum is 10. So what are the significance? How we can monitor this ABGA scoring? How we can signify this ABGA scoring system? So healthy newborns that is 7 to 10 at both 1 and 5 minutes. So immediately after birth, that is 1 minute, the score will be a 7 and 5 minutes, it will be move on to the 10. Because of the skin changes, there will be a increase in scoring. So there will be a 7 to 10 at 1 and 5 minutes. So next will be the moderately depressed. When you can see and when we can say the moderately depressed newborn means baby is having a score of 3 to 6. Okay, so 3 to 6 means that baby is called as the moderately depressed newborn. So we should give the resuscitation. Immediately resuscitate the baby if the score is 3 to 6. So next is if we are having a score of 1 to 2. So that is called as the severely depressed newborn. So that is that baby needs intensive resuscitation. Immediate resuscitation may be needed for this baby. So because it is a severely depressed newborn, the scoring of 1 to 2. So this is the interpretation of the ABGA scoring. So next we should move on to the cord cap. So first thing we should do is ABGA scoring and next is the cord cap. So the surgeon immediately after the birth or the obstetrician will clamp the umbilical cord and cut the umbilical cord. Okay, so cord care is also the next thing and important part to prevent the infection. So that is the omphalitis after the delivery. So they use a delivery like a sterile plastic clamp or ligature. The first ligature is placed about 2.5 to 3 centimeter. That is from the abdomen, and the second ligature is placed about 1 centimeter from the first ligature. So we should press between the two ligature and cut the cord by blunt sterile scissor after the second clamp. So between the two clamps, we should cut in between the ligature. Okay, so this is the correct part of the cutting of cord. So paint the end of the stump with alcohol spirit and clean the cord at the base of the cord firstly. And then we should move on to the stump from the down to up with one direction and cleaning the cord clamp. So let the cord exposed, not covered by the diaper. It should not be covered with the diaper. It should be exposed fully. So as is the signs of cord healing and signs of infection, we should regularly monitor. So baby is having any pus formation or any redness or any problem around the umbilicus, we should monitor for that. And that is erythema, edema, or any tenderness is present, we should administer the antibiotics as per the doctor's order. So this is a cord care. So next we'll move on to the eye care. So these are all the things that is immediately after the birth of the baby. What are the care? So first thing we have seen the ABGA scoring. Second thing we have seen the cord care. And third thing is the eye care. So in this eye care, so how we should clean the eyes is, so with the use of the normal like warm sterile water with the use of sterile cotton balls. So we should clean from the inner canthus to the outer canthus. For the one stroke, we should use only one cotton balls. We should not use the same cotton balls to the another eyes. So to prevent the infection to the another eyes, we should clean the eyes from the inner canthus to outer canthus in a one stroke. So next wipe from the inner to outer canthus. So next, install 1 drop of solution of isofolical. So that is in case of babies having any infection, we can use this installation of drops and wipe the excess solution by the clean cotton. So if you are using this solution, there will be a blinking. Like immediately after putting the solution, immediately the baby will close these eyes. So immediately closing of eyes, there will be a excessive solution that will be out of the eyes. So that should be clean with the proper clean cotton balls. So next will be the vitamin K injection. So immediately after the birth, administer 1 mg of vitamin K by IM route. So that is the intramuscular injection. The route of vitamin K injection is IM. So that is the intramuscular into the lateral anterior thigh. So that is a muscle is called as the vastus lateralis. Why we are giving the vitamin injection is that it is a thrombolytic agents. So next will be the identification of the newborn. Okay, so what are the things we should monitor? What should be identified immediately after the birth? So for identification of the newborn, which plays on wrist and ankle, that is a mother's name, hospital number, sex, weight of the newborn. So we should monitor whether the baby's band is similar to the mother's handband, and also hospital number and the sex of the baby. We should inform to the mothers also and show the baby to the mother also. And next, we should monitor immediately after the birth. We should monitor the weight of the baby. So next, before transferring to the nursery, ID tag should be applied to the baby. Then only we should place the baby on a warmer. So next is a dressing or wrapping is mummify the baby. So why we should do the mummifying is to prevent the heat loss, and also it will be as like a baby will be in a like mother. Okay, so that is why we are wrapping the baby as like a mummifying. So next is a wrap in a warm blanket. Okay, so we should make sure the blanket is warm or wet. So in case if you are using wetness means that leads to the heat loss, and also it is not comfortable to the baby also. We should wrap it in the warm blanket and cover the head with the stockinette cap to prevent the heat loss. So next thing we should do is assessment of vital signs. So temperature, the auxiliary method is the safest method for the baby. We cannot see the oral thermometer and oral temperature. We cannot see in the newborn baby, and normal auxiliary temperature for the newborn baby is 36 to 36.5 degree Celsius. And next thing we should monitor is the heart rate. So heart rate is counted for 60 seconds. That is a 1 minute at the apex of the heart. That is range is what is a normal is 100 to 160 beats per minute immediately after the birth. We should monitor for the heart rate. So next thing is the respiratory rate. So respiratory rate normal is 30 to 60 beats per minute when the infant is not crying. Blood pressure, so we are not routinely assessing the blood pressure in the healthy term infants. So the range of normal blood pressure in term infants is 60 to 90 mm of Hg. For systolic pressure, that is 40 to 50 mm of Hg for the diastolic pressure. So commonly we will see that vital signs including the temperature, pulse, and also the respiration. So next we should monitor for the anthropometric measurement. So anthropometric measurement, so head circumference, the normal is 33 to 35 centimeter, and chest circumference will be 31 to 33 centimeter. That is, immediately after the birth, the baby's head will be larger. So that is why the range like 33, it is more than the chest circumference. So the normal length is 47 to 54 centimeter. That is around average is for 50 centimeter. And weight of the baby is 2.5 to 4,000 grams. So next will be, we should monitor for the neonatal primitive reflexes. So reflexes is indicates whether the baby, why we are assessing the reflexes immediately after the birth is, so we are monitoring the neurological status of the baby. So whether the baby is neurologically okay means, so reflexes will be good. So if we are reflexes are not appearing means the baby is having some neurological disturbances. So what do you mean by reflexes? So what are the reflexes is there? Okay, so that is a neurological response is called as the reflexes. So it includes the Moro reflex. So next is the Sartel reflex, and third is the palmar and also plantar grasp or the reflexes. and sucking reflex, rooting reflex, swallowing reflex, and tonic neck reflex, stepping reflex, and also Babinski reflex. These are all the reflexes we should monitor immediately after the birth. So first reflex will be the Moro reflex. It is otherwise called as the startle reflex. So quick changes in the infant's position will cause the infant to throw the arms outward and open the hands and throw back the head. So this is the image of elicitation of this reflex, Moro reflex. Okay, so this is the image that shows the Moro reflex. So next is the palmar reflex. So palmar or the plantar grasping reflex is the infant's fingers or toes will curl around a finger. When we are placing the fingers inside the baby's sole or the plantar toes, so immediately the baby will curl and hold our fingers. So that is called as the palmar grasp. It is normal and it is a good neurological response. So this is the another plantar grasp. The infant's fingers or toes will curl around a finger placed in a area. So next reflex will be the infant's foot, like Babinski reflex. The infant's foot is stroked. When we are using a simple use of our fingers also, so we can stroke over the baby's foot. The toes will extend like upward, like fan folding position. This is the fan folding position of the baby when we are stroking the baby's foot. So this is the normal response of the baby. So next reflex will be the rooting reflex. So this reflex begins when the corner of the baby's mouth is stroked or touched. Immediately the baby's mouth will be searching your fingers. Okay, so that is called as the rooting reflex. Baby is searching for the feeding. Okay, so that is called as the normal rooting reflex. So next is the sucking reflex. So when the roof of the baby's mouth is touched, the baby will immediately begin to suck. Okay, so when the baby, like mother is giving a breastfeeding, starting to give the breastfeeding means, so when the mother is going in front of the baby and showing her nipple. Okay, so that is when the baby's mouth is touched means immediately the baby will grasp the nipple and started to suck. That is a normal sucking reflex. So next is the asymmetric tonic neck reflex. So tonic neck reflex means when a baby's head is turned to one side. So see this image. So it shows when the baby's head is turned to one side. So on the same side, the baby stretches out the arms and bends up the elbow. Okay, so on the another side, the baby will flex his arms. Okay, so this is the normal neurological response. So this is called as the tonic neck reflex. So next is the dancing or the stepping reflex. So this reflex is also called as the walking or dance reflex because a baby appears to take steps or dance when held upright with his or her feet touching a solid surface. So this is the image of the dancing or stepping reflex. The father is doing the like upright position, holding the baby in an upright position. The baby is like a dancing position. The baby is trying to walk. Okay, so in a solid surface. So this is called as the dancing or the stepping reflex. Okay, so still now we have seen, let me conclude the topic. So first we have seen the introduction like a neonate. So the first 24 hours is very, very crucial for the baby. So the neonatologist and pediatrician and also the pediatric nurse should be aware of the how to take care of the nurse and what are the care immediately after the birth we should give. So we should know. Okay, so it is very important in the nurse's hand should give the proper adequate care and we should assess for the continuous assessment of the baby immediately after the birth. So that is especially the 24 hours is very, very important. And immediately after the birth, what we should do is first thing we should do the Apgar scoring. So Apgar means that is the activity, pulse, respiration, rhymes, and also the respiration. So this thing we should like baby skin color we should monitor. We should monitor for the eyes and monitor the assess the nose and mouth. Any abnormalities, congenital abnormalities is seen. Okay, so we should monitor every head to toe assessment. They should be done in immediately after the birth. So after the Apgar, that is a score of 0 to 10. The minimum is 3 and maximum is 10. So the normal average, like 1 minute will be the 7, and 10, after the 5 minutes, there will be a scoring of 10 out of 10. Okay, so after that, we should do the cord care. Okay, so cord care is very important to prevent the infection and inflammation of the umbilical cord. And third thing is the eye care. So eye care including stroking the baby's eyes from the inner canthus to the outer canthus with the use of the cotton sterile cotton balls. Okay, with which is dipped in the normal warm water. So next thing we will do for the all the assessment, like head to toe assessment and also identification of any abnormalities. So like congenital abnormalities, or baby had any problems immediately after the birth because of any vacuum delivery or the forceps delivery, we should monitor for any abnormal marks on the baby's face or any other space. So next thing we should assess for the immediately after the birth, wrap the baby and dry the baby and put the baby in a warmer. And next we'll monitor for the baby's vital signs that includes the temperature, pulse, and also the respiration. The normal is 36 to 36.5 temperature, and pulse will be the 100 to 160 beats per minute, and respiration will be 30 to 60 breaths per minute. So next thing we should monitor for the neurological response, that is the primitive reflexes. Okay, so we have so many reflexes we should monitor, like Moro, startle reflex, like Moro reflex, dancing reflex, Babinski reflex, rooting reflex, tonic neck reflex, sucking reflex. We should monitor all the reflexes. We should do immediately after the birth. So it is all in the nurse's hand, and also we should take care of the baby immediately after the birth and give the baby, normal newborn baby, to the mother's hand. Thank you so much.